Look at the
can also
camera.
see from that side.
Wait. Done. I'm supposed to look at the viewers or just that like. Good afternoon, our viewers. Welcome to our today's live on YouTube. We are the Outspan Hospital, Nyeri, and we are glad that you could make to be with us today. And I take also this opportunity to recognize the presence of my panelists with me today, and also maybe people may be asking why maybe Sarah Kinyanjui is not with us today. She was supposed to be our host, but due to unavoidable circumstances, I'll be standing in for her. So feel comfortable. So on our today's live, it's all about cancer, and we are taking much concentration on Beauty and the Beast. So it's fighting cancer, and mainly we are going to major on the breast and cervical cancer. And with that, I give it this opportunity to my panelists to introduce themselves. We start from here.
My name is Sarafina Vishohi. I'm a palliative care nurse.
Thank you.
Good afternoon. My name is Simino Augustine. I'm a nutritionist, and I'll be talking about nutrition in cancer. Yeah, welcome.
Thank you so much. Feel welcome. So on my part, I'm Alex Legwa. I'm a psychologist at the Outspan Hospital. Yes, and I'll be a host and your moderator too. So let's go down to our topic today. So we are talking about Beauty and the Beast. So this beautiful woman, maybe at the peak of her career, maybe she's approaching her retirement, and she goes to a hospital, maybe for regular checkups or just some symptoms developed. Yeah, maybe, and she thought she would seek help. So she goes to a doctor, and maybe after a few tests are done, it's like, you have this and this, it's cancer. So everything maybe changes from there, and now she has to fight against all odds, and in this particular case, fight cancer. So Seraphine, take us through that.
Okay. So we're going to talk about cancer generally, and then we go to cancer of the breast and cancer of the cervix, since they are the most common cancers. Basically, when we talk about cancer, cancer is growth of cells in the body. And all the organs in the body contain cells, so they are capable of developing cancer or malignant cells, what we call as malignant cells. And cancer affects all organs in the body. It's only the hair that is not affected. As I said, because it affects cells, and all the organs in the body have cells. And cancer has no boundaries. Cancer can affect children, can affect adults at any age, and has no class as well. It affects the rich, it affects the poor, and it can affect anybody. And that's why it has become a burden in the whole world. And it is really a burden, and that is why we are talking about it. Basically, we narrow ourselves to cancer of the breast because it's the most common, and cancer of the cervix. And basically, cancer of the breast affects both men and women. But women are more affected than men. We talk about 90% of cases affecting women, and only 10% affects men. So therefore, it is also very important to note that cancer of the breast also affects men. And therefore, it's also good to go for checkup, as men, rather than when we think it is only a disease of the women. So cancer of the breast, what happens is that the cancer cells in the breast grow abnormally. That is the first thing. That happens. But we have, because we do not know the real cause of cancer, we talk about risk factors. What are the risk factors that cause cancer of the breast? And some of the risk factors is the the gender itself, because once you know you are a woman, you are already predisposed to developing cancer of the breast because it's more in women than men. The other risk factor is weight. If you have a lot of weight, you have a lot of fat in your body, then you are predisposed to developing cancer of the breast because the fat in your body produces estrogen, and estrogen facilitates or causes tumor cells to grow in the breast. The other predisposing factor is the diet, high fat diet that will in turn gain you a lot of weight, also predisposes to people developing cancer of the breast. The other risk factor is exposure to estrogen, especially when one has been diagnosed with hormonal imbalance and you are put on estrogen, you are exposed to estrogen, you have at a higher risk of developing cancer of the breast. The other predisposing factor is oral contraceptives because they contain estrogen, they contain progesterone. And these female hormones also predispose to somebody developing cancer of the breast. The other one is smoking. Smoking, people are aware that cigarette smoking predisposes to different types of cancers, not just cancer of the breast. Alcohol, consumption of alcohol also predisposes not just cancer of the breast, but even other cancers in the body. The other predisposing factor is stress and anxiety. We know stress, anxiety, there are some hormones that are produced when you have a lot of stress that also produces cancer, not just cancer of the breast. Family history, because the cancer of the breast is generally genetic as well. One develops cancer of the breast if your mother, your sister, or somebody in your family has breast cancer, then you are also predisposed or you are at risk of developing cancer of the breast. Basically, those are some of the risk factors that can make the person develop cancer of the breast. Now, when it comes to the signs and symptoms, how the person presents.
Maybe I cut you short. Maybe before you continue to the other point, it's maybe the viewers are asking. You mentioned something that also caught me unawares, especially when it comes to family planning, and especially we're in a world whereby people are using any kind of family planning method, and one of them came up with in your risk factors. So do you think, and also to remind the viewers that these are just risk factors, it's not like the causes or like it's a must that they will get the breast cancer or something. But maybe you could maybe give more insight when you on this platform, maybe for family planning. Maybe some are scared, so like they already have those family plannings, preventative measures or contraceptives. So what would be your advice maybe on that case?
Well,
Because-
this I talked about risk factors, so
Yes.
this is just a risk
A risk
factor.
factor.
It doesn't mean that you'll directly get cancer of the breast if you're using oral contraceptives or hormonal contraceptives. But if a person has a family history of breast cancer,
Yeah.
then it's good to use other methods because there are other methods of family planning. There are other methods.
That's nice.
Yeah, because somebody becomes a risk factor when you use those hormonal contraceptives.
So viewers, as you have heard, if you have a family history of breast cancer, it's always good to opt for other non-hormonal methods for family planning. Yes, and also for our viewers, you can send us your questions through our platform, YouTube Live at the Outspan Hospital. So let's continue.
Okay, and before I go to the presentation of how somebody presents who is having a breast cancer, we have 4 types of breast cancer. Depending on where in the breast the cancer is affecting, we can have ductal carcinoma, that is a cancer of the ducts. The the breast tissue itself can get affected by cancer, and the lymph nodes. The lymph nodes around the breast, the axillary lymph nodes around the armpit, they can also get affected by cancer. And cancer goes in stages. Once you get affected by cancer, there is what we call a staging, now depending on what stage the person has come up with. And it starts from stage 0 to stage 5. And in stage 0, the cancer remains confined to the ducts or in the breast tissue itself. So that means the cancer has not spread at all to any other part, locally or distance. And then we have stage 1A, and the tumor, in stage 1A, the tumor is around 2 centimeters wide or less. And at this stage, the lymph nodes are not affected. Then we have stage 1B, where the cancer is found in the lymph nodes, and there is also a tumor the tumor in the breast, which is around 2 centimeters. Then we go to stage 2. Stage 2 has 2 stages of stage 2A and stage 2B, and in stage 2A, the tumor is smaller than 2 centimeters and has spread to about 1 to 3 nearby lymph nodes, or between about 2 to 5 centimeters, and it has not, sometimes it has not spread to the lymph nodes. And then in stage 2, 2B, the tumor is about 2 to 5 centimeters, and it has spread to the lymph nodes, or it's larger than 5 centimeters, and it hasn't spread to the lymph nodes. So the stages go on and on until stage 5, whereby now the cancer has already spread to the distant organs. The last stage, it has already gone to the distant organs like the lungs, the bones, and so on and so forth. Therefore, staging is also important because of the treatment, because one is treated depending on the stage they come with. When we go now to the signs and symptoms, I'll just show you how somebody with a breast cancer, just some photos of patients with breast cancer. So you can look at that one. There is an inverted nipple, and you can also see that one. There is already a wound in the breast. You can see the other one. The breast is quite large because there is a swelling of the breast. And basically, that is how a patient with breast cancer may present, with swelling or dripping of the nipple, or even a wound, or occurs usually at late stages, what we call as a forgetting wound, and that one usually occurs at very late stages, especially stage 4 there, and that is how a patient may look like. You may find those pictures.
Thank you so much, Sarafi. And maybe before you continue with your presentation, I was just curious, maybe to our viewers, would you mind maybe expounding to them when it comes to staging? Does it mean stage 1? Is it done in a hospital? They might be asking, am I the one to maybe to self-examine myself to know where this stage I am in and all that? So is it maybe through a specialist, through just a physician or any local doctor, or what would you say about the staging?
But you have to go and see a doctor once you start noticing any problem with your breast, whether it is swelling, whether it is a lump in the breast, whether it is the color changes, because the color changes as well. Whether it is the nipple, you're supposed to squeeze your nipple and see whether there is any discharge coming out, especially if you find blood discharge coming out or any other discharge apart from breast milk. that is not a very good sign. You need to go and see the doctor. So the doctor will order various tests depending on your presentation. They may order an ultrasound to be done if you are below 40 years of age. If you are above 40 years, then you will be done a mammogram. And the mammogram and the ultrasound will show exactly where that there is a problem, if it's a lump in the breast. And for the staging, you can be done a CT scan or MRI. Then at the same time, you can also be done a biopsy to see whether it is actually, to confirm whether it is cancer or not. Because there are some tumors that occurs in the breast that are not always cancer. Sometimes we call them benign tumors, or they are harmless tumors in the breast, and therefore the doctor wants to confirm through doing a biopsy, breast biopsy, to see whether it is cancer or benign tumor. Yes.
Thank you so much. Maybe the last question on that before we continue. The presentation of maybe of a male and a female presentation, like the swelling. Is it the same for a male and for the female? Would they present the same, or there will be any variances?
They may present more or less the same, but in a female patient, the signs are obvious. You'll see the swelling, it is really obvious. But in a man, it's not always obvious. The man will have to really palpate that breast to feel the swelling, because the breast tissue is not large in a male. Yes.
So viewers, as you have heard, it's always good to note breast cancer does not only affect the woman, it also affects the man. So it's always good to, as Seraphine is telling us, to palpate as much as possible, especially to the male. We can continue.
Then after that, one is diagnosed now with breast cancer. After confirming, there are various treatments that are usually employed on such a patient. You can be done surgery, or what we call as lumpectomy. The tumor can be removed, the tumor itself, now depending on the stage. The stage is the one that guides the type of treatment one is going to receive. So the tumor can be removed. We call that lumpectomy, as I said. And the other type of surgery is mastectomy. The whole of that breast can be removed. And some doctors, or maybe a request from the patient, some patients may require or may request both breasts to be removed. But this is basically to protect also the other breast becoming cancerous later on in future. So mastectomy, or removal of the whole breast, can be done. And that also involves removal of the lymph glands or lymph nodes in the body, so that even if there is any cancer that has been left once surgery has been done, the lymph nodes do not spread cancer, and that is why they are also removed. Yes, the other type of treatment that is usually given is chemotherapy. Chemotherapy is started immediately after surgery, although there are some doctors who prefer to give chemotherapy first before doing surgery. But this is for the tumor to shrink. If the tumor shrinks before surgery, then the surgery will not be very invasive. So there are some doctors who will start chemotherapy and then do surgery and then radiotherapy. So because there are other type of treatment is radiotherapy. The patient is referred to be done radiotherapy. This is a treatment in form of radioactive rays to destroy the cancer cells that could have been left behind maybe after surgery or after chemotherapy, to eradicate all the cells.
Yeah.
Then there
Maybe I
is...
cut you a little bit. I can see a comment. Someone is asking, is it true when maybe you are taken now for surgery? Is it true to say like there is more risk? It's more riskier to do surgery when to give more, maybe to expand the life expectancy of this client? Is it true like there could be a high possibility the cancer could come back? Someone is asking, maybe is it true or false? It's a true or false question. Is it more likely to occur again or to completely get healed? What do you think about that?
Well, it's not most, okay, in some patients it may come back, but in about 80% of patients get cured. Yeah, they get cured after all this treatment.
So it's safe to say it depends also with someone's anatomy.
Yeah, it also depends on somebody's immune system and also the body. Yes.
Good point.
Because you can also suffer from one cancer, and then after some years you suffer from another cancer. Yes. Then the other long-term treatment the patient may be given is what we call as hormonal therapy, because some of these tumors are hormonosensitive. They are hormonosensitive to estrogen, as I said from the beginning, and to progesterone. And therefore, to block the effect of these hormones, the patient is usually put on hormones as a long-term treatment. Usually around 5 years, the patient takes hormonal therapy to prevent recurrence of cancer of the breast. Yes.
Thank you so much. Maybe Simiyu, maybe before Sarafin continues with the presentation, would you maybe give us an insight on how nutrition comes in? This patient has been sent to various doctors by this stage. Maybe they have been told you'll see a specialist or maybe an oncologist who is well endowed in that area. They also may be given other supportive measures in a hospital, maybe psychotherapy, maybe physio and all that. So where does your team come in? And especially, a breast is very valuable to everyone. I would say almost everyone in this world, because this is the first feeding point for everyone. This breastfeeding for every child, and you advocate 6 months and beyond. So tell us, maybe nutrition wise, what do you think?
Okay, thank you, Alex. For nutrition purposes, and breast cancer, as Sarafin has elaborated very well, there are risk factors that we are supposed to look at that can make one to get breast cancer. But what is important for nutrition part for us is we look at how we can be able to prevent one to get breast cancer, to prevent those risk factors. And two, if someone has been diagnosed with breast cancer, is undergoing treatment, for example, chemotherapy or mastectomy, we also come in to manage that. For the risk factors, briefly, I have she mentioned about risk factors that can make one to get breast cancer. That does not mean that you'll get cancer if you have these things, but they increases your risks of getting cancer. One is about weight. So if you want to prevent to get breast cancer, we must watch our weight. It's in the public domain that one should have ideal weight as per the height of that person. So to make sure that you don't have that risk factor of getting cancer, we should make sure we maintain ideal weight. Secondly, we are supposed to take the right diet, because we have some foods which can make one to get cancer. But there are other foods that can prevent you from getting cancer. For example, if we are able to take, for example, green vegetables, fruits, okay, and we reduce the amount of meat or dairy products we are consuming, we'll be able to reduce the risk factors of getting cancer. Another one is smoking and taking alcohol. Those are not food, because smoking is not food, alcohol is not food. So we are supposed to stop taking that. You see, basically nutrition, we are looking at that. Then there's also one risk factor. People who don't breastfeed, they have a high risk factor of having breast cancer. So we encourage, and in nutrition, we encourage people to do breastfeeding for their babies for like 2 years. So if you are able to breastfeed your baby, you are able to manage that. You don't have a high chance of getting breast cancer. But if you have breast cancer, we will come in now to manage all types of conditions that you have. For example, if you have a problem with low blood volume, we'll be able to advise you to take, for example, iron-rich foods to help to improve the iron in the body. Also, we encourage you to take vitamin C that will help in absorption of iron.
Yeah, maybe before you continue, maybe remind our viewers that they can ask questions through our platform. And also, Simiu has pointed a very good point. Watching our weight is very important, as you have heard. It's putting that's a risk by itself, and also a challenge to our young mothers who are breastfeeding. It's advisable to breastfeed those adorable kids 6 months and beyond to where your strength can take you. Please breastfeed them. Sorry for that. Yeah, so maybe I take the ball back to Seraphine to take us through the other presentation.
Okay, before they go to the other presentation, let me just finish completely about breast cancer.
Okay, no problem.
And I say about the other type of treatment, that is palliative care. It's also very important, that is given to patients throughout the treatment of cancer. Throughout cancer treatment, palliative care is very important because it will take care of the patient's psychosocial needs, spiritual needs, because we are treating this patient holistically. It will also take care of the patient's distressing symptoms, because a patient may come with other distressing symptoms like vomiting, they are not able to feed, they are not able to sleep, they have stress because they do not know the outcome of the condition. So palliative care takes care of all that, physical, psychological, social needs, and spiritual needs as well. Because there is a belief that palliative care is end of life care. It is not end of life care, it is just part of that. And it takes the patient up to end of life care and even after bereavement. And what I need to say here is that cancer is not a death sentence. Once you are diagnosed early, you will be cured and you live like anybody else. So it is not a life, it's not a death sentence. The other thing that is very important in breast cancer is prevention, because we can easily prevent breast cancer by doing what we call as a self-breast examination. We advise women to check on their breast 1 week after menstrual period, every month after menstrual period, because during menstrual period, the breasts are tender. So you may not feel a lump that is growing, but 1 week after menstrual period, check your breasts. Yeah, with your figure, self-breast examination is very important. You check all the areas in your axillary area. You check for any swelling for breast. You look yourself at the mirror, check if there are any skin changes, if there are any swelling, then you go and see the doctor immediately. So self-breast examination is important. And the other thing we advocate is checking, going for screening, going for mammograms every year. We advocate every year you go and be done a mammogram. You'll be done also a clinical breast examination. Once you go to the hospital, you request a clinician to check your breast thoroughly, because sometimes when you are checking yourself, you may not feel it. But when it is being checked clinically, then something can be detected. So going for mammogram is also very, very important, and checking your breasts so that you are able to be detected early. Once you are detected early, all this treatment is done and you are able to be saved. Now we go to...
Thank you so much, Seraphine, for that bit of especially the breast cancer part of it. And our viewers still remember, we are talking about Beauty and the Beast, fighting cancer, and concentrating so much on the breast cancer and the cervical cancer. And in a few minutes, Seraphine will be taking us through maybe cervical cancer. And a few points to note from maybe both Simiu and Seraphine. She has put so much effort in saying early diagnosis will save a lot of life. So we urge you, our viewers, please take all the necessary measures. Maybe, and especially for breast cancer, you have heard, she has said, try as much as possible every year, go for checkups, go for thorough clinical checkups, and that one will help in detecting if there is any cancer in early stages. So thank you so much. you can take us through your other presentation.
Okay, the other cancer we're going to go through is cancer of the cervix. And the cervix is the lower part of the uterus. If I can just show you a photo here so that you understand where the cancer of the uterus occurs. That is a uterus, and you can see the red area. The red area is where there is cancer. So the cervix is just the lower part of the uterus. It is part of the uterus. And this is where the cancer usually develops, in the cervix. Now, the cervix is only in women. So basically, the cancer of cervix is a woman's disease. It's usually or only occurs in women, and it's very common. It's very, very common. So the causes, as we all know, that the causes of cancer is not known. Again, here we talk about predisposing factors to cancer of the cervix, because the exact cause is not known, but we talk about risk factors that can predispose somebody to developing cancer of the cervix. One is many sexual partners. If a female is having many sexual partners, then they are predisposed to developing cancer of the cervix, simply because the research that has been done, about or more than 80% of cancer of the cervix is caused by human papillomavirus. Human papillomavirus, or HPV, is a virus that is transmitted sexually. So the more the woman has more sexual partners, the more they are at risk of developing cancer of the cervix. Then the other predisposing factor is early sexual intercourse. So if a girl starts sexual intercourse quite at an early age, then they are more predisposed to developing cancer of the cervix, because the cells are not mature in most of all the organs, including the sexual organs as well. So they have more chances of developing that. The other one is other sexually transmitted infections. If one is exposed to other sexually transmitted infections, because HPV is a sexually transmitted infection, they are also likely to get cancer of the cervix later on in life. Smoking is again another risk factor to cancer of the cervix. If a woman is a smoker, they are also predisposed to that. If one has a weakened immune system, like now we have seen so many patients with the RVD or HIV developing cancer of the cervix due to a weakened immunity. So those are some of the risk factors to cancer of the cervix.
So far so good. Maybe I take you back to some of the risk factors that you have just mentioned. You said one of them is having multiple sexual partners. So this one calls for what kind of prevention? Does it mean like these are a generation that we have not seen in a very so many long time, and we are telling these young people to stay safe, abstain, but you're still finding there's a lot of sexual transmitted diseases amongst youth and very young people. So do you mean like even if we can't be able to control them, can we maybe advocate for other measures that they could take for them not to be at this risk?
Okay, what we advocate is ABC prevention method. One can abstain. If you can't abstain, be faithful to one partner so that you're not exposed to HPV or other sexually transmitted infections. Or if you can't do that, then you use a condom. A condom will protect, and there are female and male condoms as well. Yes.
Thank you so much. So as you have heard, ABC abstain,
being faithful,
being faithful,
or use a condom.
use a condom.
Yes.
Our viewers, you have heard it. Let's continue.
Okay, those are the risk factors for cancer of the cervix. Then the cancer of the cervix can occur in about 2 cells. There is a cell we call squamous cell carcinoma or adenocarcinoma, but most of the cancer of the cervix occurs in the squamous cell carcinoma. And the signs and symptoms of the cancer of the cervix, how does the person present to tell you there's something wrong with your cervix? First of all, in early stages, one has no symptoms at all when the cancer is in the early stages. But when it comes now to later stages, the person will have vaginal bleeding, and they may bleed after sexual intercourse. They may bleed in between periods if they are still having their periods, if they are at that age where they have their periods. And if they have reached menopause, they'll have what we call postmenopausal bleeding after menopause. You experienced bleeding and then you stopped, and then after menopause again you start bleeding. That's not a very good sign. So any person who comes to you and they have reached menopause, they are after menopause, and they tell you they're having a bleeding, then you have to take it very seriously. You have to refer them to a doctor to be examined, because most likely it is cancer of the cervix or cancer of the endometrium, or that is cancer of the uterus, which is also there. Then the other problem they may have is watery vaginal discharge. That is false smearing. So that one, if you also find somebody experiencing those problems, then they need to be checked out. They need to be seen by a doctor. The other symptom that one experiences, they will tell you they have pelvic pain around the pelvis. They also tell you they have pain during sexual intercourse. So all this needs to be taken very, very seriously, because it can mean that that person maybe has already developed cancer of the cervix.
So before maybe I cut you short before you continue, I find it very worrying because you just told us like in the initial stages you have no signs or any symptoms. So what would you advise us maybe to our viewers? Maybe do you advocate maybe for how many checkups in a year? Because when you have no symptoms, you assume you're very okay. But cancer comes, it hits maybe at the late stages and nothing we can do. So maybe what would be your advice to our viewers?
Okay, because of that, we advise women to go for checkup, for screening. And there is a test we call a pap smear. They need to go for that every year. Because pap smear, even if the person is at stage 0 of the disease, it is likely to be detected and treated very early, at a very early stage. Yes.
That's so nice to note. And also don't forget, she also mentioned bleeding during sex and also in between periods. It's not a good sign. So don't even reach out for help. Go get checked, maybe to a medical facility. I would advise. Take us through maybe.
Then the staging can also be done. Sorry, as I said earlier, I talked about a pap smear, that when somebody comes presenting with those symptoms, they are done a pap smear, they are done biopsy to actually confirm whether it is malignant or not. But most of the time, with those signs, clinical symptoms, then with the pap smear and biopsy, it will confirm whether one has cancer of the cervix, which is highly likely that they have, if they have those symptoms. Then imaging can be done for staging reasons, like MRI, CT scan. That one can be done. The other thing that is usually done even before the pap smear, it is we call it speculum examination, which many women don't like. They don't like to be inserted that speculum and the cervix is inspected. So it's very important that when you go to the doctor and he tells you, I'm going to do a speculum specimen, it is very important that you accept to be your cervix to be examined, so that the doctor can tell you even the state of the cervix even after that kind of examination. So that is how cervical cancer is diagnosed. And once it is diagnosed early, it is treatable. Cancer of the cervix is a cancer that is 100% treatable, and one can stay for long, for many years, once it is detected early. So what is usually done is to remove the whole of the uterus plus the whole of the cervix, or what we call as hysterectomy, total abdominal hysterectomy, or TAH. That is what we call it. So it is all removed, and then the patient is done chemotherapy and radiotherapy because of the cancerous cells that may have been left behind, so that they can be destroyed, and a woman can live a normal life after this type of treatment.
Good point there. And also, she has mentioned about some speculum examination, and her being also a medical practitioner. She has just said, women, we advocate for speculum examination. Maybe it could be very uncomfortable, but it is necessary. Maybe when you go to the hospital and you are asked, maybe you want to do this, you want to inspect your cervix, you want to look at how things are. So don't feel intimidated, but appreciate the fact that someone else is looking out for your sake and for your needs. So thank you so much. Anything else maybe you want to add on that area?
Yeah, so on prevention, because prevention is very, very important. We've talked about the pap smear, we've talked about the speculum examination, and checking on the signs and symptoms of those particular cancers that I have mentioned: bleeding, irregular periods, vaginal discharge, and so on. And there is also now HPV vaccine. We are advocating for young girls between 9 and 12 years to go for a HPV vaccine. So it is very important that we don't discourage those young girls to also go for HPV vaccine, because we all know that cancer of the cervix, 80% is caused by the HPV virus.
Point to note, girls within 9 to 12 years old, they should go for HPV vaccine. So that one goes to all the mothers who have young girls at that age. It's good to take care of those young kids. And also remember, she mentioned something when young girls start practicing sex at an early age, it means they could be at high risk of getting cervical cancer. So it's also good to give sex education to your kids. It's not wrong. It's just giving information, and give information is power, I believe. So to young mothers, please take your kids to get the vaccine. 9 to 12 years old, they could get the vaccine, and I believe it's locally available.
Yeah, it's locally available.
Yeah.
Yeah.
So maybe I take this chance to I give it to Simiu this time. Maybe give us more insight on cervical cancer. Do you guys chip in it when it comes to nutrition wise?
Okay, thank you. So basically, cancer, for nutrition purpose, I said earlier, basically we look at prevention, because prevention is cost effective and is sometimes cheap as compared to treatment. So for nutrition, when we talk about prevention, prevention basically means eliminating or minimizing exposure to things that can cause cancer. And as she has told us, there are so many things that concern what we consume daily. For example, 40% of cancer are preventable through interventions as simple as eating healthy, exercising, and etc. So if we are able to exercise and eat healthy, we'll be able to prevent these types of cancers, for example, breast and cervical cancer. One of the things that we are supposed to look at when we have either cervical or breast cancer, we must observe that we have the ideal weight. In hospitals, for example, if you come in our facility, every patient who walks in must be done, what we call body mass index. And if you are admitted or when you are sent to see a nutritionist, you are able to be evaluated, because we see weight is one of the risk factors of all types of cancers. For example, breast cancer and cervical cancer. So it's good people to be observing their weight. Secondly, taking alcohol and smoking also, we discourage that as nutritionists because it's not food. As I said earlier, alcohol or cigarette is not food. Then lifestyle, exercise, what we are doing helps a lot. Then we are supposed to go for medical checkups. Medical checkups can be as simple as what you are done in the hospital, but they help to come up with big things that can affect our body. So in nutrition, we talk about foods that may lower the risk of breast cancer or cervical cancer, per se, basically cancer. So we encourage people to be taking these plant-based products, green leafy vegetables, plant proteins. They are very good because they contain vitamins and antioxidants, which helps to prevent cancer. So if you have not got cancer, don't wait to be got by cancer so that you start taking now green vegetables. In fact, you'll be taking them from the word God so that you don't get the cancer. Then we should be taking things like fish, because fish contains omega-3 fats, which also helps to prevent our body. Remember, she said earlier, taking a lot of fatty diet, it's one of the risk factors that can make you get breast cancer. So it's good to go for fatty fish, which contains omega-3 fats, which are good for the body. Then we are supposed to be taking things like berries, strawberries, and etc., which are very good because they contain vitamins that help to prevent, and they contain antioxidants, because antioxidants are very, very important in our body. They help to prevent anything that may cause cancer in our body. Then also taking fermented products like yogurt and etc. Those ones are good because our body will be able to fight, because they contain advanced nutrients that can be able to prevent our body from getting cancer. So what I'm trying to say is that what we eat is what will prevent us from getting this cancer. But for maybe you have the cancer now, you have cancer of the breast or cancer of the cervix. What is important, we will manage you as per, because we know cancer patients have, when they are getting, for example, chemotherapy, they have so many problems that come that are associated with the cancer, the treatment they are getting. For example, nausea and vomiting. So there we will advise you on what you're supposed to take. We may, for example, tell you to take small frequent meals, like 2 hourly. They will tell you not to take foods that has a lot of fat, because fat will nauseate you and etc. So those are the things you're supposed to look at. Then also there are foods we are supposed to avoid that, because they can make us get the cancer of the breast or the cervix. The alcohol is not good for us. People should not just take alcohol because alcohol is not good. Fast foods are these things that are like chips, fried things that we buy in the streets. Those are not the best for us, because we know sometimes people can put other chemicals inside to make them look better so that we can buy, and those things can cause even cancer in our body. Processed food, for example, meat, these sausages and etc. We should minimize the consumption of such things because of the preservatives they use, so that we are able to prevent, because as I said earlier, prevention is better than cure. Then taking refined carbohydrates. These are things like sodas, juices. They are not good for us. For example, I normally tell my clients, when you're buying a packet of bottled juice, it's even more expensive than when you're buying just simple fruits. And fruits are better off as compared to other things. Then because sometimes some researchers say that we have some foods when you take, they help to prevent you from getting cancer. For example, if you take apples, fruits, basically not fruits, not apples only, all the fruits are very, very important, because you see, cancer comes because you are not taking enough fruits. Then we can take vitamin B, because vitamin B, we can get it from oranges, cheap oranges that we pass over the road or in the market. They are very good. Or lentils, they are very good because they contain vitamin B that helps even to prevent one from getting cancer. Then consuming vitamin A. Remember, those things I'm talking about, we can get them from just simple things like green vegetables and fruits that we get in the market. And also, those risk factors, one should make sure that if you maintain ideal weight, you are going to prevent so many risks of getting the cancer. Then she talked about cervical cancer. Low immunity is a risk factor. How can we be able to improve our low immunity? Low immunity can be improved by making sure we take those green vegetables, the fruits. So the message here is that when you have cancer, when you don't have cancer, let us make it a habit that we are able to consume as plenty green vegetables as much as possible. But when you have a problem with cancer with the treatment, we'll now be able to be concerned and we'll be able now to be channeling down to what we are supposed to do, depending on the side effects of the chemotherapy we are taking.
Thank you so much, Simio. And the message across the board is weight. Let's watch our weight.
Yes.
That's the main point that is coming out very clear, because it's putting us at high risk of maybe breast, cervical cancer. And that goes also to our viewers. Let's watch our weight. Let's watch, especially what we eat. We have heard like we avoid processed food.
Yes.
Kama sausage,
Sodas.
and all those. And also, like, also what I have noted is like you talked about berries are very good for our health.
Yes.
So this one also reminds the viewer like sometimes it's costs. The cost also. You'll have to put some extra effort to get some good quality. You have to prioritize on your health first before you think about other things, because if you take a good look at those recommendations, the one that you should be taking, they are quite you will feel a pinch as a normal human being. You will feel that pinch, but we are advocating for healthy foods. We go to greens, we go to apples, fruits, and all those quality berries that we know. Thank you so much.
Just to add on, then also physical activity is very, very important. You see, right now, I can't remember the research I read about it, but many people in Kenya don't even exercise. About 5.2% of our Kenyan population don't engage in any physical activity. 5.2%. It may look small, but when you do that to about 50 million Kenyans, those are so many people. So we encourage our people, keeping fit helps a lot. Engage in a simple physical activity. After eating healthy, you see, when you engage in a simple physical activity, it helps to make your body healthier than ever.
Physical exercising, even if you have that vehicle, just take some few days, plan yourself. On Fridays I will be walking to work. I hope that's what you mean.
Yes.
Maybe you can visit a gym, a physio department. That is what Simio is advocating for, which will help in maintaining our weight especially. And also I believe physical exercises also helps our body to digest everything. Nutrients are sent to every aspect of our body. So thank you so much. And before maybe I give you a chance to give your final remarks, maybe let me also, I'm also an advocate for mental health. So I'll take you through a little bit of, you're talking about cancer. I come to Madam Seraphine, she tells me this and this. I'll be going in this journey with you. That one calls for my mental health. It rings a bell in there. It tells me, so Alex, where do I start? Where do I go? Where does it end? So you find like it's very hard. You find these clients will be shock will come upon them. You walk into a doctor's office or room, you're being told, what from our results, from our findings, this and this indicates it's cancer. So from there, you don't want to see even that doctor. Your reaction, anger comes in, because there's an aspect of mental health that comes in when you have such a diagnosis. And also pointing out, as Madam Seraphine said, if detectable at first stages, we have high chances of curing it, recovery. So I'm looking at it as an aspect of what all this causes to our mental health. So you'll find these clients will come with anger. They will say, I've been eating, like Simiyu advocated for, I've been eating grains, I've been taking blended juices, from direct fruits, but you find now they are trying to figure out, where did I get it? Some will blame it on sugar, some will blame it on, okay, I have a vehicle, I've never walked, now they start looking back, seeing their failures first. They will hold themselves responsible for some instances. Some will just say, I don't know, maybe God is punishing me, all this kind of denying, and that the process that they will be going through. And you see, as you said, there's a chance of recovery, but at some point there is no recovery, and that's when you say palliative care. So you're telling someone, maybe for the next maybe years that the Lord has given you in this world, you'll be under treatment for chemo. And I heard you say it's quite uncomfortable. Some of these treatment are very uncomfortable. So you're asking someone to have faith in something that they are not even sure that it will take them to where you want them. As a doctor, you're telling them there's 90% chance that we could give you back your health, but this 10% we leave it to see if treatment works or it doesn't work. So in that aspect, you find these clients will come with anxiety, depression, and some medics are quick to say they are not responding because they don't have the right support, and that's where the support system comes in. As you said, the palliative care, it calls for support in terms of family, support in terms of friends, colleagues, if you are working, and also the entire surrounding should be conducive, because you're asking me to be coming for several appointments. I will be coming to Seraphine, I'll be coming to see you maybe twice a month. That's cost. There's an impact of cost, there's an impact of coming to see people that I don't identify with. Some people will take it to heart, like, this doctor is the one who told me I have cancer, and they don't have that ability to be able to process that kind of grief to reach to acceptance. So some patients might even die even before they accept they have cancer. So it's a challenging task when cancer is made as a diagnosis to anyone, any individual. And that's where reaching out for help comes in. You have a nutritionist on board, we have a palliative nurse on board, and on the aspect of mental health, that's where we come in to support this client. And how could we support this client? As much as they can access this, maybe appointments, medication, that one is enough. Being there for them, constant checking on them, and also reminding them, it's hard to reach that acceptance. We advocate for acceptance, but we all know it's not easy. It's quite a journey, and that's why we need to be there for these people, as medics, as family members. And also keep in mind, family members are also affected, because sometimes it means this person has to come out from their job positions, they have to stop working, they have to stop doing whatever activity that they were doing to generate some income. So you're asking them, be coming to a hospital for these sessions, for chemo, for radio, and any medication that they may require. So it is an impact to the individual, and also to the family, the friends, the colleagues, and that's where we should come in support. We make it possible for these people just to access that appointment. We just say they should come for appointment, but they have to go back to their pockets. They have to arrange how they will make those appointments possible. So that's where we chip in. We also advocate maybe for counseling. It's not necessarily that we are telling them to be strong, because that one also puts some pressure on them. We are asking them just to be there for themselves, in terms of you need to give hope. You need to be there. You need to try as much as possible to uone kama kesho unaweza amka, si ndio? You put yourself in that someone's shoe. As much as we want them to get better, we also should respect their privacy, in terms of, sometimes it's always like tunasema kama medics, they are getting worse, they are deteriorating. But sometimes we forget the fact that it's also normal to get sad, because you're thinking, who do I leave my kids with? Who continues with my legacy? Maybe you had a project to do, so you're already planning what to do next. But at this point, you are not in control of that. You have lost maybe some ability to achieve those achievements. So we are asking people to provide this kind of help, being there for those people, standing with them, and it's not advisable to maybe even to give that counseling if they don't want it. That's where I say boundaries when it comes to counseling. We can't force them until they are ready, because their grieving is to an individual level, and that's where it leads me where we should not like maybe in that support system, what we should not try to do is comparing their situations with other people, because we go through that individually, because I have my own plans. I was expecting this kind of expectations in my life, So comparing situations won't help as much. So we just advocate for that support, being there, giving that person a hug, a quick, maybe a tight hand squeeze. That one means a lot to them. Showing up when they have appointments and they want you to be there,
Yeah.
that kind of support. Not necessarily like telling them to be strong and all that. Yes, maybe that's from my point of view as a psychologist.
Yeah.
Yes. So I give this chance to you guys to give us maybe a closing word.
Okay, my closing word for everyone is to go for screening. Screening is very, very important, and also to check on anything abnormal anywhere in your body. Anything that you feel is abnormal, is disturbing you, you don't stay for long. Don't stay for months, postponing, I'll go next month, I'll do this, I'll go and see the doctor, and so on. And the other thing that is also very important is to seek a second opinion. If you go to a certain health facility and you are not getting better, it's always good to seek a second opinion so that you are told what your problem is. And early diagnosis is very important. That is what we say, because once you are screened, your cancer will be diagnosed early and you'll be treated and you live like anybody else.
Thank you so much, Seraphine. Mr. Simeon.
Okay, thank you. My conclusion, I would say we should look at the risk factors, especially dietary risk factors that can make you have a high chance of getting breast cancer or cervical cancer. So, for nutritional purposes, one, we must maintain ideal weight always so that we reduce the risk factor. Let us take the right diet. The right diet means plenty of plant-based products as compared to animal-based products. For those who are able to breastfeed, let us do breastfeeding, because there is a study that says those who breastfeed have a lower chance of getting breast cancer and cervical cancer. Then let us quit smoking or drinking alcohol, because it's not good. Then to re-emphasize on that, screening is very, very important, because when you go for a medical checkup, we can pick it up early and you can get treatment as early as possible. Then for our young girls, we encourage them to go for vaccination, because the vaccine is provided by the government, so it's available. Let us encourage them to go. Lastly, let us be active. Do some physical activity, at least 30 minutes every day, so that you can keep your body healthy. Thank you.
Thank you so much. And as you have heard it from our panelists, the message across the board: go for medical checkups. They will help in early diagnosis, which will help in saving life. That's true.
True.
So from our desk, our YouTube live channel, we appreciate you as our viewers, and we are very grateful for watching. And also to remind you, as you have heard, early screening. So our hospital provides some services. Maybe would you mind to mention them?
Yes, I mentioned that we provide almost all the services that we have mentioned.
Yes.
The Outspan Hospital in Nyeri, we provide mammogram services, ultrasound services, CT scan, and MRI. So you can come get screened and you'll benefit.
Thank you, Seraphim, for clarifying that. We have all those medical checkups, maybe for screening for cervix, breast cancer, and all that. So from you can reach us through our official mobile or telephone number. That's 0722696901. That's our official line. Also, from all platforms, from Instagram, Twitter, Facebook, you can reach us through the Outspan Hospital Nyeri, and also in LinkedIn, you can also reach us through the Outspan Hospital through that name. Also through our website www.outspanhospital.org. Thank you so much, viewers, from this side of our broadcast. We appreciate, and till next time, thank you.